Hi, everyone, and welcome to Health Talk. Please welcome our host for today.
Hi everyone, I am Rigel, your host for today.
And I'm Andy.
So we are going to talk about the advantages and disadvantages of having dental auxiliaries.
So, a dental auxiliary is a person who is given responsibility by a dentist so that he or she can help the dentist render dental care, but who is not himself qualified with a dental degree. So, there are two classifications of dental auxiliaries. We have the non operating auxiliaries who assist the dentist and are not allowed to do any independent procedures or treatment. These are the dental surgery assistants or dental nurses, dental secretaries or receptionists, dental technicians, and dental health educators. Next, we also have the operating auxiliaries. These are the persons who are not dentists but are permitted to carry out certain treatment procedures in the mouth under the direction and supervision of a dentist. These are our school dental nurses, dental therapists, dental hygienists, and EFDA or expanded function dental auxiliary.
So to know more about our topic for today, let me introduce our guest speakers. First, we have Dr. Stephen Sumailu, who has been a dentist for 7 years and has a master's degree on dental public health. Let's please give him a warm welcome. Hello, Dr. Stephen. How are you?
Hello, I'm fine. Thank you.
So let's proceed with our next speaker. He's a fresh graduate and has been practicing dental medicine for about a year now. Let's welcome Dr. Elray Tubanza.
Hello everyone, how are you?
It seems like Dr. Elray Tubanza is having some technical issues, so he can't be seen in the video. So next, let's welcome Ms. Kezia Akain, who has been working as a dental hygienist for the past 5 years.
Hello, everyone.
Hello, Ms. Kezia. Thank you all for setting aside time from your busy schedule to come and join us in today's show.
So, Dr. Sumailo, what do you think are the good and bad points about having dental auxiliaries?
Hi everyone. Having a dental auxiliary has lots of advantages. For example, having a dental secretary could make managing patient easier by taking care of the dentist schedule and patient's appointments. Having dental assistant could also save dentist time in preparing the patient as well as preparing the necessary instrument needed for treatment. And also, uh, have you noticed dental laboratory technicians, which are also types of dental auxiliary, and it helps in fabricating the dental appliances that are needed for treatment. So basically, the major advantage of having a dental auxiliary is that it saves the dentist time, which means that dentists can focus doing the actual treatment. And the main, the disadvantage of this is that the dentist needs to pay or give more salary to these people, to this help, and that there is also a possibility of this agreement in management and preparation in certain treatment. Also, there are cases where dental technicians that are take dentures to patients on their own because they think they know well that to do it already. So in this cause, the patients not to visit to the dentist and get a proper treatment anymore. So that's why that's the one of the the disadvantages of having an auxiliary, uh, dental auxiliary. And also in reality, most of dental clinic here in the Philippines have only secretary or receptionist as their dental auxiliary. However, there are big dental clinics here in Philippines which have some dental assistants to help the dentist aside from their secretary. I think that's all I can say about having a dental auxiliary in our clinic.
Thank you for the information-packed answer, Doc. I would like to ask you, how many patients do you cater in a day?
I usually at least 10 patients a day. Just that's a minimum, and we can cater more with that.
That's great, Dr. Sumailo. Thank you for sharing that information to us. Now, let's hear from Miss Kesha, our dental hygienist guest, about her experience working as a dental hygienist. Miss Kesha, can you share to us how long you've been working as a dental hygienist and what you actually do and how it has been for you?
Okay, so yes, I've been working as a dental hygienist for almost 5 years, and it has its ups and downs. So I find my work very rewarding and also very challenging. So what I do is I handle the patients before they start their treatment with their dentist. I do screening and monitoring procedures, and also remove plaque and calculus by scaling and polishing of the teeth, and apply topical fluorides to help tooth decay and gum diseases. And also, I give instructions on how to properly take care of their oral cavity and dental hygiene. And I also work closely with and under the instructions of the dentist, and I do what he tells me to do. So that's all.
Thank you so much for sharing your experience with us, Ms. Kezia. Now, let's go ask Dr. Ellery Tubanza about the advantages and disadvantages of not having having dental auxiliaries.
So, hello everyone. I'm gonna discuss about the disadvantages and advantage of not having dental auxiliaries. So, without the help of a dental auxiliary, the dentists do more work, including preparation of instruments, patients, and secretarial work, among others. So, these take up a lot of dentist time and energy. Treating patients could also take longer time, which could mean that there's lesser patient to accommodate. But an advantage of this is that the dentist don't need to pay for the extra help, and the dentist is more hands on his or her practice, and he can manage it way in the way she wants. So this is good. This is also good for those who does not like to work with others and is more comfortable in working alone. Here in the Philippines, this is a common to those who are starting their practice. It's only the dentist in it. So it is one man show. So that's I can tell about not having a dental auxiliaries. Thank you.
That's very informative indeed, doctor. So, I want to know how many patients do you cater in a day without a dental auxiliary, doc?
For I can only cater or I only treat 5 patients a day.
Oh, that's quite a difference with Dr. Sumailo, who has a dental auxiliary. Thank you for sharing that, Dr. Ellery. Thank you so much, dear dentist, for such a wonderful talk. Now we have the challenges and the rewards of having dental auxiliaries in the Philippines.
So this concludes today's talk show. Thank you so much to our guest speakers, Dr. Sumailo, Dr. Ellery Tubanza, and Miss Keja Akain. Again, this is your host, Andy.
And this is your host, Rigel of Health Talk. Have a great day. Bye, everyone.
Bye.
Bye.
Bye.